Hi, I'm Dr. Monica Bonakdar, and I'd like to talk to you about OSHOT for female sexual dysfunction and urinary incontinence. Sexual dysfunction happens to both men and women. Male sexual dysfunction solutions are aplenty, and the little blue pill called Viagra is common knowledge to the general population. But when it comes to women, over 60% at some point in their lives suffer from sexual dysfunction and or urinary incontinence, but only 12 to 15% of these women reach out to their doctors. These women are in all age ranges and walks of life, from childbearing years all the way to perimenopausal and postmenopausal years. Sexual dysfunction and urinary incontinence are such a taboo subject that women don't seek professional help nor even talk to their girlfriends about this. But the real reason for few women asking for help is because solutions to these problems are not public knowledge. Many women just assume that the changes they're experiencing are part of their normal aging and they must endure. Hence, the silent epidemic continues. I'm here to tell you that symptoms such as decreased libido, trouble with intimacy and orgasm, difficulty with urinary incontinence are not part of the normal aging process. The story of why I offer treatments for these symptoms is a personal one for me. I became interested in new vaginal rejuvenation treatments because after 2 childbirths, I was experiencing urine loss during certain activities like coughing, sneezing, and some yoga postures. When I looked into available therapies, I was impressed by the substantial amount of research showing the benefits of 2 available modalities. One was OSHOT and the other was Thermiva. So I decided to have a combination treatment of OSHOT and Thermiva. My results were so positive and extraordinary that I decided to offer these procedures in my practice and help other women suffering silently. Research has shown that the cause of many types of sexual dysfunction, like the inability to achieve orgasm, painful sexual intercourse, vaginal dryness and discomfort, lack of sexual drive, along with all types of urinary incontinence, are because of the structural changes of the vaginal tissue, which results in tissue's inability to carry out its normal function. This is an incredible advancement because we're able to use your own body's blood to heal your body instead of resorting to medications that expose you to many adverse effects. OSHOT is a painless in-office treatment that uses the science of PRP or platelet-rich plasma, which are the helper elements in the blood. Wherever in the body that PRP is introduced, it starts the wound healing cascade, recruiting your stem cells to accumulate in the needed tissue and become part of the local tissue and reestablish its healthy functions. The procedure starts with topical numbing followed by a blood draw to obtain your own PRP. After the area is numb, I administer 2 simple injections, one in the internal vaginal area of the erogenous zone and urethra, and the other one in the external vaginal area, including the labia and the clitoris. There is no time, and you return to normal activity right away. Everyone worries about pain with this treatment, but this is a painless treatment. I make sure to take necessary steps so that you have a pleasant experience. Everyone wants to know how quickly they will see the results. The results seen really depend on how healthy you are. I've seen it work right away in women who are healthy. I usually say to give it about 2 to 6 months, but to the delight of my patients, it usually takes less time. The last question women ask me is how often they need to repeat OSHOT. The results of a single treatment can last for many years, but most of my patients opt to have their treatment repeated yearly for additional benefits. OSHOT can be performed with or without Thermiva. It has helped an incredible number of patients in my practice. I've seen it change lives of women who were no longer enjoying sex and were afraid of losing their partner. These women started experiencing greater arousal and stronger orgasms and began to enjoy intimacy and their partner again. I have seen it profoundly change the quality of life of women who were running to the bathroom and using incontinence pads. They gain control of their body and can hold their urine back voluntarily. I've received many flowers, hugs, and thank yous from my patients and their partners for improving their lives and saving their marriage. If you would like more information on OSHOT and Thermiva, go to my website, bonakdarinstitute.com. If you're ready for your private consultation and treatment with me in the safety and comfort of an all-female practice, I invite you to call my office at 949-721-6000. Thank you for watching this video, and I wish you many years of health and vitality.